In this video, we are going to be talking about chronic low back pain and its treatment. When we talk about chronic, the word chronic means something that is long-standing. Many people misunderstand chronic to be very severe. So chronic doesn't mean severe, it only means that the disease has been existing for a long period of time. So chronic low back pain is low back pain which has been extending over a long period of time. So let's understand what causes chronic low back pain. One of the very common causes of chronic low back pain is muscle spasm. People who are sitting in a very wrong posture for a long extended period of time very commonly suffer from back pain due to muscle spasm. Low back pain, which can be of a very long-standing nature. If they are constantly exposed to sitting in a particular position over a long period of time, it can lead to low back pain, which is of chronic nature. The other very important cause of chronic low back pain is stress-induced muscle spasm. When somebody is stressed, the muscles of the body become very tense, and that leads to low back pain, which is of a chronic nature. However, these two types of low back pain, they get relieved also pretty quickly. When a person is relaxed, posturally or mentally, that can lead to some relief in the low back pain, which is of chronic nature, but nevertheless due to muscular spasm. But chronic low back pain that doesn't fluctuate in intensity and is persistent is very often due to degeneration of the spine, especially of the lumbar region which constitutes the lower back. When we talk about degeneration of the lumbar spine, there are 2-3 elements in the spine that are affected by the process of degeneration, which is part of the aging process. One of the most important areas that is affected by degeneration is what we call as the intervertebral disc, or the spongy cushion that is present between the two vertebral bones. Every set of bones, vertebral bones, have an intervertebral disc in between them, and that acts as a cushion, absorbing the shock that the vertebral column is subjected to when one is jerking vertically. The other areas of the spine which are also subject to degeneration are the vertebral body itself, the bone itself, the joints where the two vertebrae articulate or move between themselves, the facet joints as they are called, are also subject to degeneration, and osteoarthritis of that joint, facet arthropathy as it is called, is also a cause of chronic low back pain. The other things that cause chronic low back pain are the thickening or hypertrophy of the ligaments. When a ligament which holds the vertebrae together gets thickened, that can also cause symptoms that are associated or producing chronic low back pain. In all these situations, what happens is, when this degeneration takes place, either the disc is getting protruded, prolapsed or herniated, and that goes and presses on the nerves that are emerging from the spinal cord, thereby causing symptoms in the low back, which can also radiate to the legs and so on. In cases where the sciatic nerve is compressed by this sort of a prolapsed disc, or when a muscle which is under spasm goes and presses on the sciatic nerve as well, it can lead to the condition called sciatica, which is one of the causes of chronic low back pain. Low back pain can also mimic certain other problems like gynecological problem. Chronic pelvic inflammatory disease can also cause chronic low back pain. Pain that radiates from the back to the frontal region, to the reproductive region, can also be caused due to stones or pathology in the kidney. One can also have chronic low back pain even from serious conditions like a cancer in the spine. So there are several causes which can cause or manifest as chronic low back pain. So low back pain that does not respond to conventional treatment by way of rest or treatment by way of some external therapies and is long-standing and is not responding, is not improving with treatment, needs to be investigated as to the real cause of chronic low back pain and dealt with accordingly. There are several treatment options available for chronic low back pain. One of the important things is the postural correction, avoidance of lifting heavy objects, and then mild exercises, graduated exercises based on the condition of the patient, which help the back muscles to get strengthened. That is very important part of rehabilitating the patient from chronic low back pain. Even there are conditions where these measures do not yield results, and sometimes patients are recommended for surgery in modern medicine. It is at this juncture that Ayurveda comes in really handy. because not many patients are really ready or are willing to undergo surgery of the spine. So in this situation, Ayurveda comes to their rescue, where Ayurvedic treatment comprising of some herbal medicines plus external therapies based on oils, certain herbal powders and so on and so forth, plus treatment procedures called Kati Vasti as well as Vasti, which is one of the most important 5 procedures in Ayurveda called Panchakarma. So Vasti as a treatment is seen to be extremely effective in relieving the symptoms of chronic low back pain. As the very severe cases of low back pain also respond beautifully to this course of treatment which we do in the Ayurvedic hospitals. So we at AVN Arogya integrate the whole spectrum of treatment options for chronic low back pain, in that we offer medicines. For mild conditions, we are able to solve that with just some medicines and some oil which the patient can apply at home. In some cases, we recommend certain external procedures which they can do on a daycare basis. Or if the problem is extremely severe, we offer inpatient treatment to them, where we integrate the medicines, the therapeutic procedures as well as physiotherapy, and thereafter we train them in yoga-based the exercises which can help the patient to prevent such episodes coming again and again. And in majority of the patients, we are able to avoid the need for a surgical intervention. However, there are exceptionally few patients, certain cases, where surgery also would be needed, and in those cases we openly recommend that the patients seek the intervention of surgery to get over their problem. But in most of the cases, we are able to see that surgery can be avoided with the use of appropriate Ayurvedic treatments to handle chronic low back pain.
Go here to subscribe.